Hi, I'm Matthew Clausen with MedigapSeminars.org. Welcome to our free online on-demand video series helping you understand Medicare and your Medicare choices. This series of free on-demand videos is designed specifically for those who are or will soon be new to Medicare. In this series of videos, we will cover every topic that you need to know about Medicare to make an informed decision on your Medicare choices. If you find the information in these videos useful, chances are others will too, so please like this video on YouTube and share it with your friends on social media. The more you like it on YouTube, the more likely your friends are to find it, or those who are searching for Medicare help just like you. 10,000 people turn 65 every day in the United States, and this pace is expected to continue for at least another decade. You're not alone in having to learn about Medicare and decide which choices in Medicare are right for you. Medicare is not complex, but it does involve learning a new terminology in an area that can be confusing, and it may involve making decisions in an area that you're not yet comfortable in. Our first words of advice is, as you go through the details on Medicare, don't get stuck where you can't see the forest for the trees. We will go over every step and everything you need to know to make an informed decision. But the right decision isn't going to be by comparing this deductible to that deductible or copay. It's going to come from asking yourself, what is it that you want out of your health care? What do you need? The objective of insurance, any insurance, is to transfer the financial risk of an unexpected event away from you and onto the shoulders of an insurance company. You don't necessarily need your insurance to pay every dime of every bill that you receive. In fact, insurance companies love two types of people. One is the person who doesn't shop for their insurance and assumes they're all the same, and the other is the person who wants 100% coverage, because both of those types of people will often overpay for their insurance policy. As you begin researching Medicare, one of the first steps that you should take is to go on to Medicare.gov and order two publications produced by Medicare. The first being the Medicare and You guidebook, and the second, Choosing a Medigap Policy. Simply go to Medicare.gov, type publications in the search bar, and that will be your first choice, will bring you to where you can order your publications. Now, you can get these in hard copy mailed to you. You can also download a copy onto your computer. I personally like the downloadable version because in that form I can simply type Control F, which is a control find feature, and a search bar will come up to find anything I'm looking for within those publications. When you're ready to enroll in Medicare, you do so through Social Security. You can go to the Social Security office or socialsecurity.gov website. They also have many useful retirement calculators to factor in your Social Security income. Take note that full retirement age for Social Security for those of us born between 1943 and 1954 is 66 years old, not 65. Every year you delay your Social Security income up till age 70 increases your income by 8%. So use the calculators on the Social Security website to see if delaying your Social Security income is right for you. If you already get Social Security income, then you will automatically be enrolled in Medicare Parts A and B. Your effective date will be the first day of the month that you turn 65, unless your birthday is the first day of the month, and then it is the month before you turn 65. If you are automatically enrolled, expect your Medicare card to arrive about 90 days before its effective date. If you are under 65 and disabled, and you will automatically get your Medicare Parts A and B when you have been disabled or been on Social Security income for 24 months. There are exceptions to this. For example, if you have ALS, you'll get your Medicare right away. Your Medicare service is divided into parts. For example, Medicare Part A, Medicare Part B, Medicare Part D. We will go over each of these in detail in later videos, but for now, understand that Medicare Parts A and Parts B are the foundations, the pillars of Medicare. Medicare Part A is that which covers your inpatient hospital expenses. Medicare Part B is the insurance that covers your outpatient and physician services. You can sign up for all parts of Medicare during what is called your initial enrollment period. The initial enrollment period is a 7-month period that encompasses 3 months before you turn 65, the month you turn 65, and 3 months after you turn 65. Sign up early because there are penalties or delays for signing up late. Medicare Part A is free to anyone who is eligible for Social Security income. Medicare Part B has a monthly premium. Now, as of 2016, that monthly premium is approximately $121 a month for those who are making $85,000 a year or who file jointly and have a joint income of $170,000 or less. If your income is higher, then your Medicare Part B premium will also be higher. That Medicare Part B premium is typically taken directly from your Social Security income payment. If you are delaying your Social Security, then you'll need to find another source from which the Medicare Part B can be paid. You do not need to start Medicare Parts A and Part B at the same time. Now, this is important. If you will continue health care coverage through your employer or through your spouse's employer and you have credible health care coverage, you can delay starting your Part B, and you should delay starting your Part B. What you will want to do is talk to your employer benefits provider and find out from them how they handle your turning 65 and on Medicare. You should do this 5 or 6 months before you turn 65. For smaller businesses, those with fewer than 20 employees, Medicare will take precedence over any of your other insurance coverage. And as a word of caution, not all credible health coverage includes credible prescription drug coverage. If it doesn't, then you will need to get a Part D prescription drug plan. Check again with your employer. If it is credible coverage, then they will be providing you a letter every year stating that you have credible coverage for prescription drugs, and that you use that letter when you do eventually sign up for Part D so that you are not penalized. So to recap, your initial enrollment period is a 7-month period that starts 3 months before you turn 65, includes the month you turn 65, and the 3 months after you turn 65. You enroll in Medicare through Social Security. Anyone eligible for Social Security income gets your Medicare Part A for free, but Part B has a premium to it. You can start your Part A, and typically is done because it's free, but delay your Part B if you have other credible insurance coverage. We encourage you to start researching and investigating at least 5 to 6 months before you turn 65. In our next video, we're going to be covering Medicare Part A and Part B. If you like these videos, this video series, then please like this video on YouTube, share it with your friends, and check out the other videos in our series at MedigapSeminars.org. I'm Matthew Clausen from MedigapSeminars.org. Thank you for watching.